a clinical ethicist, and I have to tell you a story about the first ethics consult I ever saw. Really was a learning experience for me. I walked into the patient's room and I said to the family, "My name is Kathleen. I'm the ethicist for the hospital." And the mother of the patient put both her arms over the door and said, "We do not need an exorcist in this room." That was a really telling moment for me. I realized that no one, in fact, knows what an ethicist does. An ethicist sees clinical ethical dilemmas. These are cases that occur in the hospital where treatment becomes too much, too extreme, or not what the patient wants. Most people don't think that they can be someone that are in these situations. But I'm going to tell you a story today so you yourself can ask the question, would I ever be put in a situation like this? Could I ever be a part of an ethical dilemma? This is a story about a sweet, sweet woman named Mary. Mary was 76 years old and had 3 wonderful daughters, Jane, Jenny, and Judy. Judy was a nurse, and Mary knew so much about health care. Jenny was a stay-at-home mom, so she did a lot for her mom. She made sure that she always had the groceries that she needed. She noticed when her mom was having signs of early onset dementia and took her to the doctor. Mostly Mary was very independent. She went to bridge twice a week. She cooked her family a Sunday meal. She even kept the grandkids on Saturday evenings, and everyone felt very comfortable with this, despite a little bit of memory loss. Jenny stayed on top of it, and Judy really felt as a nurse she would know when Mom had gotten sick. The thing the girls did not know is that Mary had congestive heart failure. Now, congestive heart failure was treatable, and she was progressing through life, living well, driving. She was very independent. So this was something that was left out of the family conversation. But again, Mary was doing very well. One of the days, Mary felt a lump in her breast. So she went to the doctor, very worried, and it turned into a stage 3 breast cancer. All the girls gathered round and went back to the oncologist with her. And the oncologist was very, very hopeful and very, very confident that they could get through this breast cancer. All she would need was a surgery and some chemotherapy. So the girls went through this with their mom, went to all of the appointments. She got through the surgery and she began her chemotherapy. The first round of chemotherapy, she went home and had some complications. The girls did not know what was going on. They were very upset, so they brought her to the hospital. Let me take you back about 3 years. Mary had gone to her church, and she had heard a talk about living wills. She knew that Judy, her nurse daughter, would take care of everything, and she knew that her girls were very well educated and a part of her life. But she thought that she should make her wishes known. She didn't want to choose who would be the decision maker. She thought that Judy, her oldest, as the nurse, would naturally step into this role. She didn't know that if you don't decide who becomes the decision maker, all 3 of the girls would need to decide together if anything came up. But she thought she had taken care of this because she put on her living will, on her advance directive, that she wanted to allow a natural death to occur. She had said to her girls lots of times, "Don't ever put me on one of those machines. I've lived a good life, I'm strong, and I want to die at home peacefully because I've lived without all of that." So back to our story. Mary's in the hospital, and she is getting worsening respiratory failure. She's not able to breathe very well. The doctor says to the 3 girls, this may be because of what's coming up with not only the complications from chemotherapy, but also with her congestive heart failure. All 3 girls are very taken aback, wondering why their mom did not tell them that she had congestive heart failure. They thought they knew everything. Before they can think twice, their mom is being intubated. That means she is being put on a life support machine. The doctor said she's really having trouble breathing. I've got to do this to get her through. And of course, the girls, not thinking twice, say, yes, save our mom. We've got to get her through this cancer. 9 days later, Mary is in the intensive care unit. The girls are fighting. Judy says, Mom said she never wanted this. Jenny says, I know Mom better than anyone. I took care of her. And of course, they're just not on the same page with what to do for Mary. Mary is someone who had said again and again, she saw her husband pass away at home. She never wanted to be on life support. She thought she had taken care of this. But she was not a do not resuscitate. She had simply made her wishes known in a living will. And her girls didn't know what to do. Now I'm going to step back from this story because I want you to think about how easily you could become Mary. Mary was well. Mary was independent. Mary had educated girls who helped take care of her, who came to family dinners, and all worked together. But Mary was stuck in an ethical dilemma. As an ethicist, I was called in because the doctor was facing a decision. Should the doctor put a trach in her neck to permanently hook her up to life support because it did not look like she was going to get off this machine? The girls were totally divided. 2 said, yes, do everything. Let's get Mom through. 1 said, absolutely not. We are not going this far. These girls thought they had done everything right and they were in the middle of an ethical dilemma. So we talked. We talked about what their mom would really want. We talked about why things had gone awry when they thought everything was okay with their mom. We talked about what her life had been like and what it would be like in the future, even if she did get a little bit better. She still had many rounds of chemotherapy to get her through the breast cancer. She would never want to live on a life support machine. And she just didn't want to go through this ultimately. But that window of time to decide when to stop, when to talk about end of life, is so difficult for so many people. Ultimately, the girls decided through this ethics consult that they were going to let their mom be taken off the machine and die naturally. Mary was placed on hospice, never left the hospital, but did die peacefully 1 day later. Now I ask you, how could all of this have been better? What could those girls have done? Number 1, there's got to be a conversation that happens with the living will. You have to look around your community for places like a caregiver institute. For example, the Adele Caregiver Institute, where there are people who know how to talk to caregivers. Jenny was a caregiver for her mom, even though her mom was independent. Judy was a nurse who was a caregiver who needed some support as well. That support could have prompted a conversation that did not put them down this road. You have to make sure that your loved one is being honest with you about your illness. Mary could have gone to a palliative care clinic with her congestive heart failure. That would have addressed her symptoms, and the physician would have had a goal conversation for what Mary would want going through the chemotherapy. There's more that you can do for your loved ones to get ahead of these conversations, and we are here to help you. We are here to help you live. Founded by the community, we help people live independently and die well.